do some. Welcome. Right, what do you think? Another couple of minutes? 2 more minutes?
Yeah, give it one more minute and then we'll,
1 more minute.
yeah.
Okay. Happy New Year to everybody. I think it's not too late to say that.
I know it is the 21st of January. Is it too late? Is there a certain time where you stop saying it? I don't know.
I think it's the first time you see somebody in the new year. I'm going with that, unless it gets to about June, and then probably it would be a bit daft, wouldn't it? But
I think there are 8 weeks in January. Isn't that right?
oh, but it's absolutely 8 weeks at least.
Yeah. That's the window.
Okay, I think we should get going, if that's okay with everybody. Welcome. I'm Sam Whittle. I'm a diabetes specialist nurse, and I run a course called Refocusise Diabetes Rehab down in Bournemouth. And today, obviously, our lovely Julia is with us as well. And Julia is an education and research lady from, you're physio, aren't you? Physio in
My background, yeah.
background. But mostly education and research now. And we met up a couple of years ago at Diabetes UK, and we shared our love of activity and long-term health conditions, but particularly diabetes. So this group was set up last year when we went to Diabetes UK and started a professional interest network for activity. They've unfortunately not managed to invite us this year, have they, Julia? And we are gutted. I'm sure they've forgotten us. But they have already booked us and invited us and give us an hour slot for 2027. So we're very excited about that, and we'll take that. So today, may I introduce Andrew Power, who's National Health and Wellbeing Manager for Swim England, and he's going to tell us all about swimming, aquatic activity. I love that, Andrew. Aquatic activity and how that can help with diabetes. Thank you.
Thanks, Sam. I'm just making sure everybody can see the screen okay. Just nod one more time. We've tested it out before, so it should be fine. Apologies, Mr. Harris, Andrew Harris as well, my namesake, in advance of this presentation. I'm going to largely focus on healthcare professionals as an audience, and sort of what we've done at Swim England. But and you'll have heard some of this already before, Andrew, but some of it might be new to you as well, and might be quite useful in light of further discussions we might be having in the next couple of months as well with LRS. So yeah, good morning everybody. I'm Andrew Power. Start my clock because I tend to talk for too long, so I'm on a limit. I'm on a countdown of 23 minutes now. So I'm as Sam said, I'm the Health and Wellbeing Manager at Swim England. We're the national governing body for swimming and other aquatic sports, but we do have a health and wellbeing stream, of which has been ongoing for the last probably 10 years. But before I start this morning, just wanted to sort of set the context a little bit and just show a brief video from our Swimming as Medicine series. This features Michelle Turner. I don't know if anybody's come across Michelle in your travels. Michelle is a nurse practitioner, but also a physical activity clinical champion on the PAC program, and just covers some of the thoughts and experiences of some of her patients in the Shropshire area of England. David, who is the one of the featured, sorry, just get that slide back. David, who's one of the featured participants there, talks about how he uses swimming to help manage his type 2 diabetes, and there are other messages about how swimming helps with other long-term health conditions and comorbidities as well. So really interesting and entertaining start to the presentation, and then it'll all be downhill from there. So enjoy. Sound okay?
From
my experience as a nurse, I know that the patients that I've talked to about swimming have gained massively for their health. So I would advise any nurses to have that conversation and signpost to swimming, raising awareness of the benefits it can give so that other people can get those too. So my role as a nurse includes working with people with long-term conditions and building that relationship up with the patients and helping them to find ways in which they can help to improve their health. Swimming is a really good example of a way in which you can improve your physical activity and aid recovery from illness and prevent ill health.
If I hadn't taken swimming as part of my lifestyle, I am sure that I would be suffering from some of the complications that type 2 diabetes brings. If I'm particularly feel my joints are achy and I'm not sort of 100%, I get in the pool and actually most of those problems go away.
The benefits I've seen from doing the classes in swimming is that I think from like aqua, things like balance, suppleness of the body, and then swimming, because I have a problem sometimes walking and things like that, swimming I can just swim and it's just easy and it's just enjoyable.
Because I have osteoarthritis in my hips and my neck, and my life was becoming more and more narrow because I was losing my mobility and becoming very depressed, and came along to the aquatic. Being in the water was like magic.
And as nurses, we have the power and influence to help our patients think about becoming active through swimming. And by us mentioning first to the patient about that and talking about the benefits, that next step may be that we refer them on to our health coaches or our local providers to find out where there is a service that can help that person get back in the water.
For me now, I wish I had obviously taken up swimming much earlier. Not only physically do I feel better, but mentally I feel better. I would recommend it 100% to anybody.
Okay, I'll just finish that there and hopefully move on to the next slide. So I just wanted to show that because I do realise I might not necessarily be talking to a converted audience when it comes to aquatics. And this isn't necessarily me from Swim England coming along and telling you how wonderful swimming is compared to everything else. And that, I've seen plenty of presentations over the year. I was at one recently at the IPMC, the Integrated Personalised Medicine Congress, where dance was purported as the best thing since sliced bread. Obviously, I'm going to talk about swimming and tell you how wonderful that is. But just briefly, I wanted to touch on some work that we did in 2017, our Health and Wellbeing Benefits of Swimming report, which was a series of 6 systematic reviews of the literature around the impact of swimming on health and well-being, society, and other themes. And that was a significant piece of work and started us on this trajectory in terms of looking at how we could make swimming and pool spaces more accessible, inclusive, and welcoming to people with long-term health conditions. So really, really important piece of work. But I've just picked out some of my favourite bits that I feel just emphasise that there is a case for swimming as an essential element within physical activity messaging. And I think as a result of the consequence of the pandemic, I guess sort of slipped down the rankings to an extent in that the public health messaging tends to be very fixed around walking and cycling perhaps and park run and other types of activity, and sometimes swimming doesn't get a mention. And there are reasons why it should. At the top there, a significant study on mortality rate. Surprise, surprise, found that swimmers had lower mortality rates than the general population. No shock there, but it was also really clear from that for whatever reason, we don't know the mechanisms and don't understand that yet, but the mortality rate was lower in swimmers than walkers or runners and other types of activity too. So explain that one away if you can. But looking at MSK health, another study there, meta-analysis of RCTs, water-based exercise, I'm talking about exercise rather than swimming, was as good as land-based exercise in terms of improvements in pain, function, quality of life, and so on. So not better, but as good as. And I think if not better in some cases, certainly a better option for some people that we might come across on a day-to-day basis. So final one, which is probably my favourite, it's the Concord Asian Men study. You probably don't think of swimming as a frailty and falls prevention activity, but the Asian Men study discovered that swimmers had two things: lower postural sway, faster narrow walk test, which actually contributed to a lower rate of falls in the swimming group compared to any other sporting activity. So swimming has something about it. Aquatic based exercise and activity have something that other types of activity do not. But I think it's also really important to think about the population, think about the individual, and think about their needs and how swimming can meet their needs. So particularly in the sphere of diabetes as well, and sometimes the complications that come with that. Really important to think about how we can work around some of these barriers and issues that people have. So swimming and aquatic activity are pretty unique. And it was interesting that the authors felt that it was possibly the contribution of swimming in terms of falls prevention was a result of horizontal body position in the water, impact on core strength, and the dorsiflexion kick of the ankles as well, that might actually help in some cases in terms of prevention of falls. But we know that water has different properties to air. Buoyancy, viscosity, water is a lot thicker than air, there's resistance there. Even the thermodynamics of water and temperature can have an impact on people who can derive benefits from being in the water compared to being on land, and the hydrostatic pressure of water around the periphery as well also has some quite dramatic effects on pain modulation, other factors as well. So there are some really unique benefits to being in water that need to be considered and included in some of our discussions potentially, or our thought processes or biases towards activity. But ultimately, swimming feels right, in inverted commas. And in Swim England research we conducted recently, our England Swims research, investigated this phenomena a little bit further. This was over with 4,000 non-swimmers. Through a piece of diversity research that we did, which included questions around people's long-term health condition status as well, and including all health condition audiences. We found that if people were asked around their capability to be more active, 69% said yes, I probably could be more active. There might be some things and barriers that need to be removed, but 79% said yes when water was the subject of the discussion when that question was asked. So people felt they would be more capable of being active if water was involved than if they were asked to go and walk or cycle or run or whatever that might be, particularly those with long-term health conditions. So, and we've done additional work as well. Some of you may have seen this in sort of on social media and other outlets as well. And we published a report called the Value of Swimming Report a couple of years back now, which demonstrate that swimming generates 2.4 billion in social value in terms of the economy, but also helps to prevent 78,500 cases of ill health. I've got the breakdown for that if anyone's interested later, but diabetes is a consideration in that in terms of prevented cases of ill health per year. And I've added on the presentation as well, I've added all of the links to the various documents and articles and so on. So you should be able to follow through when the slides are circulated after today. I've passed on to Julia, I think we might pass them on. So when I have conversations with healthcare professionals, I think one of the no-brainer resources that we do have available is our Pool Finder system. Pool Finder is a web-based tool which allows a simple postcode search to be able to find your local pool, the pool that's nearest to you or closest to you. It includes a database of thousands of public and private pools across the country in England, Scotland and Wales as well. But what we've also done with this is added filters to the postcode search function to help identify additional parameters. So you can search for hydrotherapy pools, you can search for aquatic physiotherapy sessions, good boost sessions. I'll explain good boost later for those who haven't heard about it. Dementia friendly swimming sessions, and also accessibility options as well. So does the pool have a lift system or a hoist system to be able to help people get in and out the pool who might have difficulty? And you can search and filter searches for different types of activity and accessibility options, changing spaces, all sorts of things, so that you get, it's not just about finding the closest pool, but finding the right pool for the individual in front of you. And it could be a really useful tool, easy to use for professionals and the public alike. And we have over 500,000 views of Pool Finder each year, which push people to their local pools. So you can also identify through Pool Finder your local water wellbeing accredited pool as well. And I'm going to talk a little bit about that, because this is the work that fell out of the 2017 review. Water wellbeing is about supporting pool providers to be more accessible, inclusive and welcoming to people with long-term health conditions and impairments to be able to swim and get in the water. And there are lots of things that need to be right to allow that to happen. And the diagram to the right is the process that we follow with providers and pool operators. In a formally recognised programme, that pools need to meet minimum requirements to be able to achieve accreditation through. So that is our water wellbeing accreditation scheme. So a water wellbeing accredited site and essentially means that those sites are working towards being, as I mentioned, more accessible, inclusive and welcoming. And it's a 3-stage process. So it's around, first of all, addressing accessibility issues and inclusive customer service and other issues that would maybe prevent people from even getting to the pool in the first place. Also looks at delivery, personalised delivery and aquatic offers, the qualifications of the workforce to therefore be able to deliver such offers. And all sites as well have the requirement to monitor and track progress. They're expected to demonstrate their impact on health and wellbeing outcomes, and we provide all operators who work towards this water wellbeing accreditation with all of the resources and the support to help pool operators to implement this, and essentially to do it well. So not just to say that we've got some great activities in the pool, but the whole environment is conducive and supportive to people with long-term health conditions and diabetes, in your case. So currently we have 217, as of yesterday, 217 sites that are accredited across the country. Now, that's not a huge number. We probably have about 1,200 public pools in England. So in context, that's just a small percentage, but there are hundreds more sites currently working towards this accreditation. It's currently a live initiative, and I would envisage that we'd hope to be at 400 sites by the end of next year. If we get to 500, 600 sites by the, following that, we're probably looking at sort of 1 in 2 public pools will have this water wellbeing accreditation. Some pools will never achieve it because they're not accessible. They may be aging, and the pool stock is aging, and there are problems in that sense with pool closures around the country. But what we're trying to do is make as many pools as possible as accessible and inclusive as we possibly can. And it equates to tens of thousands of hours of personalised delivery. I'm going to explain what I mean by that in pools across the country. So even if you pop onto Pool Finder and find disappointedly that you don't have a water wellbeing accredited pool near you, there may be a provider who is currently working towards accreditation near you currently. So we're working with a number of the large and smaller operators across the country to take them through this process and work towards that accreditation. So I guess one of the things I mentioned in terms of accessibility, which is really important, is our the environmental assessment tool or checklist that we use with sites. This is really, really important because our insight was not just about the barriers to being able to participate, are not just sort of the qualifications of staff and the offers in the pool, but it's the experience that you get in public buildings and facilities, which can often turn you away and cause you to have a negative experience. So this environmental assessment tool is a checklist to help identify the pinch points and the barriers. in the physical facility that might prevent somebody or contribute to that experience that they have. It's car park to pool assessment, I call it. So very much looking at things right out in the car park kind of distance. Are there sufficient disabled parking bays, dropped curbs in the car park, everything that might actually pose a barrier to somebody who might have some sort of limitation. And once you get into the facility, is signage clear from reception to the changing areas? Once you're in the changing areas and you manage to find the pool, can you get back out of the pool and find the toilets easily? There's lots of elements that will contribute. I mean, if somebody gets into the pool and they have slightly impaired kidney function, one of the first things that they'll need to do probably is the pressure of the water pushes their circulation and shunts the circulation back to certain areas of the body, is probably need to go to the toilet in a hurry. And so suddenly people get in the pool, and after 10 minutes they have to get out of the pool and suddenly quickly find the toilet. And if they don't do that quickly, if they aren't able to find that, it sounds maybe less urgent or serious, but it can contribute to a negative experience, embarrassment, and potentially that person not continuing their physical activity journey. So still really, really important. And that's a really important step. And sites cannot become accredited until they have addressed the essential barriers that have been identified through that assessment. And often that means physical changes to the physical facility and environment, signage, and other information. Even stickers on hand dryers to indicate what they are as well, so people don't get confused if they have dementia or other issues and they can't figure out what this silver box in the wall is meant to be there for. So simple things that can sometimes make a big difference to individuals. And we've developed qualifications. On the left, we've developed a level 3 aquatic activity for health qualification, which is essentially being designed for level 3 exercise referral instructors who by definition will largely be land mammals by definition, and will have probably had most of their qualification experience will have been land-based in gym environments or group exercise environments. And don't necessarily understand the water and how to navigate the water with patients and and customers. So that qualification is being designed to bring them up to speed. They may already have an understanding of long-term health conditions, but don't necessarily understand the water and how to work in it. Then on the flip side, we've worked in terms of developing a new CPD for our swim teachers, which there are tens of thousands across the country, but don't necessarily understand health conditions when faced with that. So if somebody comes into a pool and mentions that they have they're type 1 diabetic and they need, that there are certain considerations that need to be made, the swim teacher may not know that. There may be a rabbit in the headlight scenario when they're told that somebody has COPD and I'm just carrying this oxygen canister next to me, is that okay? All the kinds of questions that they might need to know and be able to deal with. So that's about understanding the conditions, their medical management, and also how to adapt their swim teaching around the individual. So in addition to that, we have public facing resources, and some of these are diabetes specific. So for instance, our swimming and health conditions fact sheet, one that we've worked on around diabetes and swimming, that we worked on with Diabetes UK and the team there. These fact sheets are around breaking down the misconceptions that people might have around their ability to swim. So you may have that conversation with them, but they say, but I can't swim because, and then all the excuses or the reasons come out. And that's what these are about. They're about those misconceptions. They're about top tips and hints to help people have a more positive experience when they do decide to go to the pool. And get in the pool and experience all the benefits that could come with that. They've all been developed in conjunction with some of the major health charities and other technical expert content inputters. And we've also developed other resources such as the one on the right, which is a downloadable flyer in terms of things that you might think about if you have a health condition. So for instance, diabetes included in that. So if you're possibly predisposed to hypos, make sure you have a snack with you on the pool side. Make sure you bring that with you to self-administer. other considerations, just to let poolside staff know if you might be at risk of having a hypo, so things that maybe if you didn't mention to that individual, it becomes a major problem or a bigger problem when it does happen on the pool side or in the pool. We've had participants in the past who've come to pools with angina and haven't brought their spray with them. So in that instance, all that happens is if they've forgotten to bring that spray with them and it hasn't been mentioned in their journey, they get in the pool, they start to swim, angina happens when it happens, and it's a 111 scenario. It's an emergency services call rather than something that could be resolved easily and readily. So there are a number of pointers brought out in some of these resources that just remind people and help them to reduce the incidence of negative experiences occurring when they first go to the pool or subsequent journeys. The water wellbeing program, we tend to focus on, delivery is about personalized support. It is a multi-morbidity programs with flexibility built in for personalization. What you won't probably find, or probably, are specific sessions around diabetes in pools, but we do see some targeted sessions happening around the country, dementia-friendly swimming sessions, swimming for cancer sessions, but largely water wellbeing is about creating activities where there is space and flexibility to be able to adapt around the individual. So we don't tend to accredit sites that have just put on an aqua class for 50, 60 people all jumping around in the water with one instructor at the end. We think about what needs to be in place so that if an individual is struggling or needs additional support, that is catered for in terms of delivery. So very much around personalisation, adaptation to individual needs. So you will have people with diabetes, with cancer, with other conditions in the pool together and exercising together rather than specific sort of condition-specific groups as such. And in terms of healthcare professionals, so we've rolled out the red carpet in terms of the water wellbeing program, making pools more health focused and welcoming to people with long-term health conditions. But we also asked the question in 2020 in terms of how do we leverage healthcare professionals to have discussions around physical activity and around swimming specifically. So we conducted some research in 2020 that pointed out that while swimming might not be front of mind in healthcare professionals' psyche, there is much that needs to be done or could be done to encourage healthcare professionals to, as I use the phrase, to ask, suggest, or equip people to be able to get in the water. And in addition to our fact sheet resources, you've just watched one of them, and the pool finder changes, we developed the Swimming as Medicine series. We work with RCGP, CSP and RCN to create these 3 short healthcare professional facing films, exploring the point of view of different healthcare professionals and their patients. Really powerful messaging, and the assets are freely available to use on healthcare professional facing websites and communications and presentations and training materials, whatever that might be. They're available on YouTube, but if you want to actually have the individual video assets for use in different ways to embed and so on, it may be easier to have access to those. Please do contact me if you'd like to use them and influence other professionals around you to get involved in these discussions around water. And please watch them all yourselves later. You've seen one, so there's only 2 more left to watch. And we've also worked with NHS England, the Aquatic Therapists Association for Chartered Physiotherapy, the University of Nottingham, to develop an NHS accredited eLearn, the Aquatic Activity and Swimming for Health eLearn that follows the journey of an individual called Leon, who hasn't been near a pool for years, wants to get back in the water, has a bit issues in terms of low mood. His GP's told him that he's at risk of developing type 2 diabetes. And it talks through the barriers, how to negotiate them in conversations with individuals, the sort of settings and professionals that might be involved in a patient journey like that, where to find out more. It is a pass and fail module. You have to do a test at the end, but you don't have to do the test. But if you want the certificate, you do. But it's really interactive, really engaging, probably takes about 20, 30 minutes to complete. And as I said, it's accessible via the NHS Learning Hub if you have an account. So I guess my message today, approaching 26 minutes, so I'm over time already, but I guess is the next physical activity discussion that you have, just please try and consider water in the mix. And when your patient says that they can't walk and they can't cycle and they can't run and they can't play walking football or anything else, maybe water might be the solution for that individual, and perhaps in the majority of cases it probably will be, where they feel that they can't be active but they can in water. So could they swim, or could they simply get moving in water in some shape or form? Use Pool Finder to locate the local pools near to you, search for activities or sessions that might be appropriate to that individual, like Adult Learn to Swim or other things. I didn't mention Good Boost actually, and I did skip over that one, but Good Boost is the aquatic rehabilitation tool, uses AI to be able to identify and devise individualized exercise programs on tablet PCs for individuals, which they can have on poolside, waterproof tablets that you can't break. And a really innovative and evidence-based program that's rolling out across the country currently as well, and it's moving towards multi-morbidity and other long-term health conditions rather than the MSK approach that initially took. So you can find out about those Good Boost sessions where they're located on Pool Finder as well. But please do seek out and use the other resources that are available. Get in touch with me if you've got further questions, and hopefully encourage more people with diabetes to get into the water and just enjoy the benefits. Thanks for listening, everyone. Sorry for going over. There's my email address if anybody wants to get in touch, but I'll put it in the chat box as well.
Thank you, Andrew. That was really good.
I was about to say, has anybody got any question? And Louisa's got a hand up straight away.
Really great presentation. It's really nice to hear what's going on. I think it's really difficult. We know, well, first of all, I think I was on the panel that wrote the aquatic activity for health qualification actually back in the day, but really interesting to hear how it's evolved since that. But what I wanted to say is thank you for making us aware of all of the resources that you've got available, because within our team we deliver a lot of physical activity in clinical settings, and a lot of the individuals who come into the weight management service, and a lot of the individuals that are in some of our research programs, we signpost out, and actually swimming is quite appropriate for a lot of them. I mean, there's obviously barriers with swimming as well, but we have been trying to go through the exercise on referral route, but now I will speak to colleagues that deliver the sessions to have a look on the Pool Finder and everything that you've just mentioned. I think half the time it's just knowing what's out there, and unless you come to these presentations you don't know. So this is why obviously this is really important. But I just want to say thank you, great presentation, and really pleased to see how it's evolved.
Okay, yeah, and I think that's one of the challenges is just integrating into pathways. Swim England are a national organisation. We don't own pools. Someone like Andrew in Leicestershire and Rutland area will be much closer to what's happening at a local level as well. But it's about getting that information into existing systems, and there's some work ongoing with the Active Partnerships Network nationally to look at how we do that, so that you don't have to stumble across me in a presentation like this on a Wednesday afternoon. That it will be, built in hopefully in the future. So yeah, thanks for that, Andrew.
Yeah, thanks, Andrew.
Yeah.
I think you've actually covered that first point. Louisa, if you want to know what's going on in LLR, you know where to come to. So yeah, I can pick up conversation with you regarding, which of the pools locally. There are 7, I believe, that have got the water wellbeing accreditation across LLR. So, and again, if you need linkages into any of those for whatever reason, yeah, you know where to come. The other question I had was actually for you, Andrew. So obviously I've stayed quite close to this kind of evolving piece over the last several years, really. One of the biggest barriers that won't be news to anybody is around financial hardship. So have you got any, I don't know, evidence or best practice of working with a particular leisure provider who's managed to be quite savvy with, reducing financial kind of access barriers to people, because with the way leisure management companies operate now, they are businesses. They need to ring the tills, and they need to make a profit. However, we know that the likelihood is that if people are living with a long-term health condition, there's also in terms of that intersectionality, a good chance that they're probably not quite as affluent as other demographics, and we know that that's a huge barrier. Even if it is only £4 or £5 pay as you go going into your pool, by the time you've got in a car or paid for travel, it can be quite costly. So is there any kind of evidence nationally or good practice nationally that I could be made aware of to help kind of leverage conversations with our leisure management contractors?
Yeah, I think we did some work with Hussein Al-Zubaidi. Does everybody know Hussein?
Yeah.
TV doctor, quite prominent in the physical activity field. He's one of the physical activity leads at RCGP, and we did some work with him with Everyone Active in New Bowls, in up north of Coventry way. Sorry, my brain's a bit scattered today. But and it wasn't. I don't think we've had any examples other than that where activity was completely free for individuals. Initially, it was a pilot program, and Everyone Active, and they wanted to have a swim session to complement the walks and running groups and so on that the local PCN had developed. And they wanted a swimming session as well in addition to that. So we helped in terms of the establishment and the setup of that, the training of staff. We actually got some of the teams within the PCN, so the health coach and the social prescriber and link worker, trained up to be able to facilitate the sessions. So they were just very casual activities and sessions twice a week, once a fortnight, just very casual. So it gave people an opportunity to get in the water for the first time in maybe a while or ever. And eventually the ICB eventually picked up, after the first pilot and the service evaluation of that, picked up the funding for that for the participants. So it was originally, I think it was something like maybe it's about £2 for a session once a fortnight for individuals, and then the ICB picked up the funding to be able to cover the cost of that completely. But people were only taking part every couple of weeks. They were possibly doing other things as well, maybe not. But what happened as a result of that, and one of the reasons why Everyone Active were happy to continue to subsidise it anyway, was the number of people who then demanded and wanted to be active more often and wanted to swim more often with the friends that they'd made in the group and became facility members. So they worked out a kind of a health and wellbeing membership category that would allow people to just come at a more reduced cost than a traditional membership, which could be anywhere between 25, 30, 40 pound a month, at a much reduced rate, to be able to just swim more regularly with their friends after they'd gotten hooked on that activity and saw the benefits for themselves. So originally it was kind of just every 2 weeks, which kind of whet people's appetites a little bit for this, and then when they realized they wanted to do more, they were able to take advantage of the setup that Everyone Active had. So there have been examples, and there are examples where good boost sessions have been paid for, again by sort of maybe physiotherapy services and ICB funding and other stuff that's been pumped in there. Nuffield Health have done some really interesting work recently in completely flattening cost across a lot of their facilities on their health and wellbeing program, and they've covered that out of profit. So out of the foundation's profit, the Nuffield Foundation's profits, they've been able to pump that back in to create X number, a limited number, but X number of free Nuffield Health memberships to people with long-term health conditions. So that's worth looking into. I've got further information on that came out just before Christmas, if anyone's interested in looking into that further, if you have a Nuffield Health wellness facility near you.
Yeah, thanks, Andrew.
Anyway.
It does, and again, I heard Davina talk about the Nuffield Health stuff actually at the BASM conference in November. So really interested to keep an eye on that one, because we do have a Nuffield site, one or two actually, and it's also interesting as well that Everyone Active with a leisure provider that you work with over in Hussein's kind of neck of the woods, and everyone active have monopoly over much of the leisure contract sites across LR. So that's given me some ideas. So thanks very much for that. And again, really keen to explore any kind of, I know you've spoken with Joe Active together regards to potential working with directly with us as an active partnership. So yeah, thanks very much, and be keen to keep an eye on that one.
Great. Is there another question, or
Yeah,
have I got an Scot-free?
Catherine.
No, Catherine.
Yeah, Catherine's got a hand up.
Hello, hi. I'm a researcher at University of Derby, but just on that point, I was part of the grad scheme through Active Together in Market Harborough back in 2019, so pre-COVID. And me and some of my colleagues set up a aquanatal class. So I just wondered, with women going through pregnancy, we identified that that was a good activity for them to do. We trained up an instructor in aquanatal. All of that obviously stopped from COVID, but I just wondered if you'd had any sort of thoughts or done any work sort of with gestational diabetes.
No,
because I
we
think
haven't.
that is,
Yeah.
I suppose an additional worry for them, but maybe swimming is something that they could do. Yeah.
Yeah, I think the best go-to resource from an aquanatal perspective, or from a pregnancy perspective, is the Active Pregnancy Foundation, and some of the resources that they have available. Obviously on Pool Finder, I'm just double checking that now as I go. On Pool Finder, you can search for specific sessions and specific activities. I don't believe at this point, that aquanatal sessions are part of the search tool for that, but that is something that we can build in the future as well, just to build a picture of what's happening and where. But the Active Pregnancy Foundation, there are a whole host of resources there for professionals to be able to access, and we would probably, if we were doing something along those lines, we would probably lean on the Active Pregnancy Foundation and do something in collaboration with them, but not yet.
Yeah, it was a really good start to it, but unfortunately we only got about a month in, and then COVID hit. So yeah, definitely there's a need there, I think. So yeah, thank you for your presentation.
Okay.
Got your hand up, Sam, again.
Sorry, yes, no, I did. Catherine, that was really interesting. So thank you, Andrew. I already thanked you, didn't I? But that was very interesting about the aquanatal, because there's a lot of aquanatal in Bournemouth. And in all our BH Live leisure centres, and it'd be interesting to know if the people with gestational diabetes do go, and I can go to the clinic and ask if they're actively suggesting that, and I could also go to the pool and find out how they're dealing that way, because most gestational will be on insulin, so that does make it quite probably a bit nerve-wracking getting in a pool and exercising. So yeah, that was a really good point. Thank you for that.
Any further questions specifically for Andrew on his presentation? No. I think from my point of view, I think because we've got a couple of things for our conversation sort of now till the end of the session today, and it's kind of a lot of it we've already talked about in terms of, and it was going back to some of the conversations we had very early on when we were setting up this what was called a PIN, this special interest group, and that was about when is the right time to talk to people about physical activity when they've been potentially diagnosed with diabetes. Is it later on? Is it in primary care? Is it in secondary care? Just to try and identify at what point, we've got all this amazing evidence that we keep talking about to do with long-term health conditions, and obviously we're here today because we're all sort of involved in diabetes and things, but it's like, how do we change this? How do we get people into these, like, when's the right time to really be promoting this for people? Because there's evidence probably either way, isn't there, that it's when they're newly diagnosed, because that's going to have the biggest impact on their long-term health, or there's also a lot of evidence that people are just not ready at that point, and is it later on? So I suppose it's picking up a bit of that that conversation, but also around, you mentioned around social prescribers. I heard you mention around social prescribing, Andrew, and just wondering sort of how, whether people, this is to everybody really, whether people use social prescribers very actively in their area for referral on to active lifestyle programs, GP referrals, or is it done themselves, I suppose. So it's a question for everybody really.
And health coaches as well. I mean, there's still, I think there's still a number of health coaches swimming around in PCNs as a result of ER's funding and investment there. So yeah, really important to lean on other professionals. I think one of the things we've found in the research that we did in 2020 that I mentioned in the slides there was that it's just that concept of either being able to ask or just ask the question, to be able to suggest, which is starting to build on that a little more, and to be able to equip. And sorry, physios, but nurse professionals came out top in terms of their ability to equip people because of the number of contact points over a period of time with individuals, and you'll probably appreciate that. Whereas potentially, maybe with physiotherapy, it might be a number of contact points, but over a really short space of time, and then you're done, and then you don't see them anymore. And obviously, you don't get to speak to your GP for very long, so they only have the ability to drop the question or the subtle hints. But then we need to get them to people who can spend more time, particularly those who will not be more active or feel that they can't be more active and have a whole host of barriers. But that's another presentation for another time, and I don't want to dominate.
Yeah. Joe?
Oh, hi. Sorry, I logged in late for the presentation, so if I might try and catch the recording,
it's been
if
recorded.
that's okay.
Yeah.
Thank you. But I caught the end of it and it was great. And I have to admit, it's not something I ever think of swimming. I swim myself, but I never think of including that in my diabetes consultations as a diabetes nurse. So thank you. From the point of view of social prescribers, I'm a diabetes nurse down in Bournemouth, and I know Sam very well. We've got real social prescribers. We have, certainly for the PCN I work with, it can be 6 or 9 month waiting list, which is not ideal. But I try and do a lot of education with my healthcare assistants so that when they're doing the initial, we split our diabetes annual review up into 2 parts, and the part 1 is done by our healthcare assistants, and they do all the donkey work, if you like, for me. And so I've got all the lovely results in front of me, but we do a lot of education with the healthcare assistants to promote exercise, but not always using the word exercise, because as we know, some of our patients don't particularly, they think of gym kits and all the rest of it, and that's not for them. But I will certainly be feeding this back to them, because I think swimming is it's a totally different type, isn't it? And hopefully patients will be good. And also, yeah, I agree, for the gestational diabetes, definitely as well. It's really good. So I was just going to say that. Thank you.
Thanks, Joe. Yeah, I think with the social prescribing sort of side of it, I mean, I haven't got much experience at all. So, but I know from pieces of work I have been sort of, or in meetings where we have tried to sort of think about social prescribing. Where I work is, we're very much in secondary care, and that's made it, obviously social prescribing is very much in primary care and trying to access those types of services. It's quite, like say, it's all to do with PCNs. It's different within GP practices. The waits can be extremely long, never quite sure which direction to go in. And I suppose in terms of type 2 diabetes, and the reason that we're here is about trying to promote physical activity, is one of the ways is up there, just as much as medication and education, is that referral on to physical activity, where they can have a real impact very early on in somebody's diagnosis. So it's just trying to understand how we sort of change that pathway, I suppose, that we keep talking about, of getting the diabetes, the activity much earlier on in people's pathway at the point of diagnosis. Vicky?
Hi, sorry, thanks for the presentation. And if you don't mind me not putting you on the spot, Joe, but from what you've just been sharing there, what do you talk like regularly with your patients around physical activity and exercise, or what services people do you refer to or use or suggest, or is it
like quite personalised for patients just to go and do something like walking or what really?
So I organise 3 monthly meetings with the diabetes team, if you like, within the PCN. So try and, because I don't always have the time, if you like, in my consultation. So trying to educate the healthcare assistants and other nurses to do that. And obviously we're very lucky in Bournemouth that we have Refocus Eyes, which Sam runs, and we can do gym referrals to our BH Live local gyms. We talk about walking a lot, but we try and use the term. I've got a very mixed population. My PCM, we've got a very affluent area where there's a lot of yacht clubs and people that go sailing, but then we have a very poor population as well who couldn't afford gym memberships, and a lot of them are not well educated, and they don't know, they're often come into my diabetes reviews with their bags, and I can see their Lucozade and energy drinks in there, but they don't actually always have the knowledge. So a lot of what we're talking about is just moving more generally. So I try and get the healthcare assistants to plant the seed, if you like, in the first consultation, and if they've got any real concerns, they book the follow-up with me, and they'll send me a little internal note to say this patient might want to join the gym or whatever, and then I try and pick that up. But I unfortunately don't have the time in all my consultations to bring it up, sadly. But we've also got Live Well Dorset, which I'm guessing you have something similar up that way, where they can do some extra bits, but Refocus Eyes in the gym generally, and just generally getting out walking and stuff. It'd be great to have some walking groups and things that, I know some surgeries across the country do that, don't they, with some of their diabetic patients, and I'd love to have the time to be able to do that, but I think our managers who hold the purse strings would not be wanting to, they don't always see the bigger picture, I guess.
Yeah,
secondary
that's
care's responsibility, but yeah, that's generally it, if that answers that.
Yeah, thanks for sharing those. And that's the thing as well, it's like time, in consultations to actually cover everything that you need to. Sorry, I'm on my phone because I'm out and about today, but I'm not putting any people on the spot, but just to help with discussions. I saw Catherine was nodding quite a lot there, so I don't know if you wanted to add anything.
I'm just doing a systematic review about all of this at the moment. So yeah, all of these barriers were coming up a lot. So and it's across the world. It's not just the UK. Time is the biggest barrier. And yeah, it's having those referral options that you're aware of in your area, in your locality, and are they updated regularly? And a lot of that relies on people running sessions actually contacting you to say, we have this session, we can give you this flyer, so you can give it straight to the patient. But as we know, funding sometimes drops, and then these sessions don't carry on. So it's I agree a lot. There's a lot to be done, but there's some great stuff going on, but it's just communicating, I suppose, with the healthcare professionals and people in the community what they're doing. And yeah, it's difficult, but yeah.
I think there's lots of different options potentially, but like you say, keeping on top of them and knowing what's out there is quite difficult, especially if you're covering a wide area. And I think just to touch on there and what Joe was saying as well, I suppose it's having lots of people keep mentioning it in slightly different ways or whatever. So it's a bit like throwing mud at a wall. Hopefully it will stick at some point. So like what you were saying, Joe, maybe like the more you can educate and get out get the word out, and that more people just keep mentioning it, and people might think, oh, okay, that might be a good idea, or maybe I will take something forward.
Yeah.
May I have a go, please? Yeah. I think as everyone's saying, the more we talk about it, the more it will come up, and it will naturally just roll off the lips, won't it? And I think it's been a long time hidden, and I think it is starting to get more and more talked about. And we may not have the time that we used to, but we do have these very clever people in surgeries now who do texting, and there's lots of apps as well, lots of activity apps, and some really good resources out there. And again, Joe, it might not be for all of our patients, but if we directly sort of hit in about 85 directions, then hopefully everybody will find something that they can, you know, we can't force the gym or courses and things on everybody. We'd love to, wouldn't we? But it's just not right for everybody. But I think the more we talk about it, and that's what this group is about, more talking about it and sharing ideas from up and down the country, things that are going on, service improvements, you know, and sort of just gaining knowledge from other people. I think we'll get there. Thanks ever so much for everyone for coming. Any last words, Julia? Oh, our next one. Is there any more questions, or we've got our next date, provisional date, haven't we?
We haven't got the speaker as such sorted yet, but we've got a plan. But yeah, the next session, we're because obviously these are just sort of always online, and so we're thinking in May. So we've actually got a session for the 13th of May. So same Wednesdays, 12:30 to 1:30. And we're hoping that we can get a presentation around type 1 diabetes and some of the exercise considerations and things around type 1 to start to try and think about the differences in terms of patient information around type 1 and type 2, and thinking about addressing some of that. Often information is presented together, so thinking about whether where is the crossover, where is the point where the guidance is the same, and then where does it potentially separate. So we'll be thinking about that for next time, but a speaker is yet to be confirmed. So that's, like I say, 13th of May, 12:30 to 1:30. Yeah, so thank you, and thank you very much to Andrew for coming and talking to us today. It's always really good to hear about, and like obviously me and Sam had heard you speak, which is why we wanted you to come and do this. So it's always good to hear from somebody that's really passionate about their area. So thank you very much for coming today.
Pleasure.
So yeah, we'll be in touch about the next one, and potentially any bits of conversations or groups before then. Obviously we have got lots of people on the distribution list, but not everybody can make it, hence why we've recorded it today. But if you could keep spreading the word, and we will keep, you know, if you do and we do, to try and build this list to make these sessions as interactive and as useful for everybody. So lots of people here with lots of different ideas from different parts of the country as well. So if you spread the word and we spread the word, that would be great. And obviously you've got mine and Sam's emails of points of contact as well.
Thank you, guys. Lovely to see you, and enjoy the rest of your grey day. Might as well be working, mightn't we?
Yeah.
Thank you.
All right. Thank you.
Bye.
Bye.
Cool.